Hello, my name is Kelly McCray, and I'm currently a registered nurse. I plan on becoming a nurse educator. So I am currently from St. George, South Carolina, a very small town, and I'm now located in Atlanta, Georgia, where I right now work at an orthopedic unit at Piedmont Healthcare. So on my unit, my typical day-to-day, I take care of post-op spinal patients. I take care of joint surgery patients, hip replacements, cervical, lumbar spines, and we also take care of a great deal of med-surg patients. Those are your very high acuity sick patients, high blood pressure, diabetes. We have some patients that come to us that may be on a trach. So my typical day-to-day normal experience is at the bedside. I work with a ratio of 1 nurse to 6 patients. It can get very, very stressful. It can get very, very fast paced because we have a high turnover, being that we have so many joint surgeries. A lot of the joint surgeries are outpatient, but they are coming into the hospital at least a day to stay overnight to be cared by us nurses. So typically in my nursing environment, I do 3 days a week, 12-hour shifts, but I am actually the new unit educator on my unit, which I'm so glad to be a part of the education side of nursing, because that's something I want to get into. So being the unit educator, I onboard new nurses, I precept, I onboard experienced nurses. I do a lot of the teaching and a lot of the in-services for my unit, so I really, really love that role. So I chose healthcare. Basically, it was a no-brainer for me being very young. My grandfather, who was at home, he was taken care of by hospice nurses. He was on hospice care at the time. He was in his last years of life, and I just remember the nurses that would come in with their all white. They would pray with my family. They would be very comforting to my family, helping my grandfather, giving him medicines, giving bed baths. They not only cared for him physically, but they cared for him mind, body, and spirit. So that's the main reason I wanted to become a nurse at an early age, is to be that nurse, be that person to care for patients holistically, mind, body, and spirit. So for me, my journey into nursing financially has been a hardship. Getting into nursing school, I got in at a university. I did not make the med-surg class. I failed by like 0.5 points. I just remember being very devastated, very upset that I basically failed out of a nursing school. So I was depressed at one moment. I was really, really taken back, and I was discouraged into going to nursing school, but I stayed the course. I went and got my biology degree, graduated with plenty of student loans. I have thousands of dollars in student loans from my biology degree, which I entered a nursing program at that time. So those loans stick with me. I actually moved out and I went into nursing school again. I got my courage up to try it again, entered LPN school, and I was successful. So I graduated from LPN program. I graduated from an ADN RN program. So I basically found the resilience in myself to keep going, to keep pushing, to be that nurse that I always wanted to become. So what it means for me to be a nurse, being a nurse is basically I'm a superhero. I feel like I'm a superhero at the bedside for my patients. I take care of my patients. I educate my patients, and that's ultimately what I plan to do, is become an educator. So the impact that I want to make in healthcare is basically using my journey, my trials and tribulations as a nurse, to show other nurses that it can be done. To all of my student nurses that I mentor, I want them to know that it can be done. I am a resource. I plan to be a mentor to help other students get through, and that's my goal, to impact nurses, is to create CNAs, create nurses that care at the bedside. My path right now, I plan on impacting nursing. 5-year goal is to mentor students on my platform of Instagram and Facebook. In 10 years, I plan to create more schools under my leadership. And 10, 15 years, I want to create awesome nurses like me to basically know that they can do it. My motivation for nursing is to inspire others, to give others that hope and that dream that they can too be a nurse. They can too stay the course and do awesome work into nursing if that's what you want to do. My motivational song is Dream Big by Jasmine Sullivan, because I'm going to dream big. I'm going to make it. And what I do is just going to be phenomenal. And I thank you for offering this scholarship.